superior mesenteric, the vein of superior mesenteric should be lateral side of this. And the vein of this, again, lateral than this. I mean, the veins of these two, superior and inferior mesenteric, support these arteries. I mean, they are lateral than the arteries. And I told you before that the inferior mesenteric goes up and join to splenic vein. Yes? The inferior mesenteric vein reach to the splenic vein and join to each other. Yes?
Yes. Make portal.
And then it goes to the right, and this one join to that and make portal. Yes? So splenic goes to this vein, superior mesenteric and portal vein, and so it's joined to this. Yes? So inferior mesenteric and superior mesenteric, both of them reach to the portal vein. Yes? Portal vein. But here, that was superior rectal. And I told you we have inferior and middle. Yes? Inferior and middle was branches of
Internal.
so the veins from this drain to what?
Internal.
Excellent. To internal iliac vein. Internal iliac vein join to external on both sides makes what? IVC. So these two reach to the IVC. IVC. And these two join to the portal vein. Or in other ways, they make the portal vein that going to the liver. Yes? What happened? I told you the blood of the portal vein has not any permit to mix by this before filtration. But after filtration, they get this permission that mix to each other. It's clear? Could you please tell?
No.
No? You say yes?
Huh?
Is it clear? Yes.
No.
No? Please, yes. What I mentioned about the veins,
About the
permission of drainage of these veins. What did we discuss? What did I tell you about the direction and permission of these venous places? So listen carefully, please. If it's not clear, ask me, not just looking me. And then yes, yes, clear. I told you inferior mesenteric and superior mesenteric by splenic make the portal vein. Portal vein, as you can see here, collect all of the venous plexus of the digestive system, and it should be joined to IVC after being filtrated. Yes? It means they go, this one go to liver and then empty to IVC. Yes? So, these two, I mean port and cover before filtration of the portal vein has not any permission to mix to each other. It's so clear. It means if they mix to each other, it causes problem for the person. It's some kind of disease. Because the portal vein, the portal venous plexus filled by digestive material. First should be detoxified, should be storage some parts, and then after that, liver drain that brain to the IVC.
So the filtration occurs in the liver?
In
Liver?
liver.
Mm.
Yes. So, if they mix to each other, they make problem. And if liver find any disease and being ill, it means liver cannot do its job perfectly. Yes?
Yes.
So, there is no choice. This blood should be connected to the IVC. And of course, it causes problem for the patient. And it maybe you saw some people who has had before liver disease. They have a belly that filled with water. Yes. In the abdominal cavity, they have a lot of liquid that is caused the belly being very large, and of course some other problems. So because of this problem, the portal vein should be drained to general vein. There are some pathway between port and cava. One of them is here. Look here. These two joined by the vein of this. Middle and inferior rectal, middle and inferior rectal joined by inferior mesenteric, superior rectal. It's clear, yes, they should join to each other because it drain the upper part of the rectum, these two drained by these two. These two goes to IVC, this one goes to portal, yes? So there is a junction between port and cava. Yes? Please tell us.
We have two veins that goes to the portal vein, then to the liver.
Where is the junction between port and cava?
Pancreas.
At the
Nickel.
Inferior
rectum
middle
and
rectum.
anal canal.
Yes.
Rectum and because inferior mesenteric veins drain this part and this middle and inferior part of the rectum drained by these two. So these two directly go to IVC and this one go to portal, and all of these three anastomose to each other. So if there be any block here, this blood cannot go to the liver, so they drain through this to this and go here. Yes? It's not usual. It's when we are speaking about a patient who have liver disease, not normal people. In normal people, as these are connected to each other, but not letting any drainage happen. They do not mix to each other. They don't mix to each other. It's clear? I'm sorry, he is one of my
Take
colleagues.
your time.
Sorry. Leave you, please. It is you. What happened for this part? I mentioned about weak, but
There is an anastomosis between the portal, which goes to the portal and the IVC and the rectal.
excellent. Which veins drain this part or connect this part to the portal vein? Inferior mesenteric. Inferior mesenteric. Inferior mesenteric. And which one drain the blood of this part to the IVC?
Superior and middle.
Inferior and middle rectal. Yes? Because there is a rule. Any arteries, the veins goes through the arteries. If these arteries originate from the iliac, so they should back to the iliac vein the same. So at this part, I mean at the most lower part of the digestive system, anal canal and rectum, these three connect to each other. So if some person, ill person, that cannot drain the portal vein to the liver, and liver cannot properly do its job, so these veins should be backward and through these two reach to the IVC. It's not normal, it's unnormal, but we have this anastomosis in our body. Yes? Second one, this one, number 1 and number 6. Number 2, back to the left gastric artery. Can you remember left gastric artery? Left gastric artery. I told you this is the esophagus and this is the stomach, yes? Left gastric artery from the celiac, this is the celiac, reach to this, supply this and this, yes? This one. So, the vein of this, I mean left gastric vein, should be back and joined to the portal vein. This is the portal. It's clear because the venous plexus of all part of our digestive system should back to port. Yes? Portal vein. So, here, this venous plexus back to the portal vein. And as I told you, the left gastric supply the esophagus, yes? Esophagus comes up, I mean it started from the or larynx here, yes? So, the venous plexus of this routinely can go to the IVC. Of course, it's reached to the SVC, going up, okay? S to it, yes, SVC. So, the venous plexus of this part, I mean the most lower part of the esophagus, connect anastomus by this one, left gastric veins. So again here, there is a connection between cava and port. Am I right? In reality, in our body, we have this junction, but they not work. Just they stop because blood of the port, if back to cava, it causes some problem for us. As I told you, this blood is filled or full by nutrition substance. It should be detoxified and saved, or some process should be happen on them. So directly, if they reach to the cava, it causes problem for us. Number 3. So number 2, number 1, and number 3. Around our umbilicus here, I show you in the slide that there are a lot of superficial veins, yes? These superficial veins by two para umbilical veins. Para umbilical veins. Para means at the vein, yes, being equal vein. Para umbilical veins from the umbilicus reach to the portal vein. This one. So we have two paraumbilical veins that they join anastomus by the superficial veins that we have here, and these two directly join to the portal vein. course in liver, but in portal vein. So, the number 3 being these para-umbilical veins around the umbilicus. So, if someone faced the problem not to drain the portal vein to the liver, or in liver disease, these 3, number 1, 2, and 3 should be open. They open and being large and turtle like this, like Waris. Have you ever heard about the Waris or leg? Waris, the venous plexus being turtle and enlarged. Yes?
Varicose?
So, yes, varus, something like this.
Oh, but really.
So, in this part, it caused some problem. I mean, in that patient, this venous plexus at the anal canal being enlarged and tortuous and reached to the outside and bleeding. And here at the esophagus, again, because this venous plexus being enlarged, they bleeding again here. I mean, that patient with this problem, vomiting, blood vomiting. Okay? And at this one, around the umbilicus, because para-umbilical vein try to drain portal vein to the superficial vein, this superficial vein being enlarged and tortuous, and make a special shape. The shape of the venous around this make a kind of shape that they say caput medusa. Medusa, caput medusa is the head of a monster. It's very awful shape. Here, if you search for the portal disease or liver disease and search for caput medusa, you can find that on that patient, all of the veins plexus being tortuous and find enlargement, so they are not in normal shape. But we have bleeding here, and at this part, there is some problem for that patient. Have you ever heard about the hemorrhoid? Hemorrhoid means this enlargement of the varies of the vessels here. So these three connection are main connection between port and cover. Port and cover has 3 main connection, but this connection not working in normal person.
Just
It is
liver
really-
disease.
Sorry.
There's no connection, there's not any problem.
Just in liver disease, because the liver cannot receive the portal vein, so the blood in the portal vein cannot drain. Okay? So it should be back to the general circulation by cover any parts, same as anal canal, esophagus, and umbilicus, because in these places the port and cover anastomose to each other, and portal force by force drain the blood to this connection, they being enlarged and make hemorrhoid, or here cause bleeding on that person, or around the umbilicus
Protrans.
cause
is being enlarged. Okay?
If still there is some point that is necessary, I mention you, please ask me. Look here, these two, this one and so close to this, these are para-umbilical veins. Para-umbilical. And these are superficial veins. Here, these two joined by this vessel and drainage of portal to this cause the caput medusa.
Blood from the middle recta and inferior recta is directly go into the inferior vena cava. So it does not create any problem because they are not filtered by the liver.
In real life, this junction between, for example, superior rectal and middle rectal not working. When we face to a problem for the liver or port, then port by force drain its blood to this connection. But in natural life there is no problem. They not drain or doing something that the port and cava being mixed to each other. Never. Do you remember the Riolan arc that I mentioned you?
Yes.
Yes? Riolan arc was connection between what?
Inferior and superior mesenteric.
Remember the figure.
Left branch of
Left
branch
curic and curica media connect to each other. So, look here. These two junctions happen in mesotransverse column. In mesotransverse column. Look to the, let me to find the transverse mesocolumn. Transverse mesocolumn. Look here. This is the transverse mesocolumn. Am I right? So, this is the curica media, left branch, left curic and right branch. Yes? They join to each other and make here the Riolan arc. This space, look to this space. There is the least junction between these arteries. If you look to here, they are connected to each other. Yes? Here there are a lot of arteries. Here again we have. But here there is not any extra connection between these two. So, this space named Riolan space. Riolan arc, and this one is Riolan space. If you ask me, what's the useful of Riolan space, I say, through this Riolan space, if you be a surgeon, you can make a cut here, without any problem, you can reach to the bursa umbilitalis. So, Riolan space is a space with at the least junction between these arteries. So we can easily make cut and go inside. But now, look carefully and tell me. Doctor, where are you? Look and answer my question. Riolan arch is below or above the transverse column?
Below.
Above.
What?
Above.
What?
Because we are lifting the greater momentum.
Excellent. Here in this picture, we pull up. If you let it down, so it could be above, not below. Yes? Thank you. Okay. Look here, portal vein. This is a portal vein. This one is left gastric. Left gastric vein directly joined to the portal vein. So here the connection between esophagus and this let the junction between portal and cava. Portal and cava. Please, when you are studying in your text or any reference that you have, certainly, surely you should back to this slide, atlas, okay? Check, discuss to each other, find, not trying to memorize, trying to find the reason. Because of that, it's help you that being, you can keep more long time on your minds.
No,
Okay.
it's not. You cannot buy it.